In this video, I'm going to demonstrate IASTM to the hamstrings region. Okay, so to reduce a little bit of friction, I've already placed a small amount of medium onto the client's skin. We do want to create some friction between the tool and the client's skin, but we don't want too much so it becomes uncomfortable. Okay, for the purposes of the video today, I've used the Physique lotion, but you could use wax or oil or anything that you already use within your clinical work. So we want to warm the area up first. So the hamstrings are a nice big muscle group. So I'm going to use the bar to do long sweeps on the area. This will help to warm up the tissue. This is quite a big bar. You could get a smaller bar and that might be more appropriate for your client. Okay, so with the bar you have got the convex and the concave edge as well, so you can switch between the two. Okay, so we're going to do the long sweeps up. I will just want to warm the tissue up. I want to get the client used to the feel of the tool in this area as well. So we're just helping to increase a little bit the localized blood flow. Okay, so I've just spun the tool around just to use the other head as well. And you will get quite a bit of feedback from the tool, so you'll be able to feel where your client is holding more tension. Okay. So I can feel with Lydia today, she's got more tension nearer the belly and the bottom of the hamstrings. So I'm now going to use a smaller tool and I'm going to come into some friction slides here. Okay, just focusing still, trying to cover the whole of the muscle, but also focusing a little bit more into where the client's holding more of their tension. Okay, ideally, remember to check the pressure as you change techniques with the client. Okay, how's that feeling, Lydia?
That's fine.
Okay, good. So you want the client to be able to feel it, but it shouldn't be painful. Okay, so small friction slides over the whole of the muscle. Okay, so you don't have to use all of the techniques in your clinical work that we're covering today in this video. You can mix and match to meet the client's needs. So the next technique that I'm going to go into is active movement. I'm going to use the same tool for active movement because it's quite a nice size for this client's hamstrings. I'm just going to remove the bolster so that the client can get their leg all the way down to the couch. So with active movement, we could do this actively or passively. So what's going to happen is as the client extends the leg, I'm then going to sweep the tool up the muscle tissue. Okay, so if we were doing this passively, I'm lowering the leg down as I'm doing these long sweeps. Okay, and then actively, the client is going to be in charge of flexing and extending the leg. So I'm going to give Lydia the weight of the leg now, and she's going to flex and extend as I'm moving the tool up the area. Okay, just be mindful as well that the client doesn't kick you, so don't lean in too much. Okay. So that works really well. Nice when the client is doing this actively, because when the client is moving the limb themselves, they're creating heat as a waste product because they're producing muscle contractions. So that will also help to reduce more tension in the tissue. Also, they're activating the nervous system too, they will feel the difference when the muscle is in that contracted phase to when the muscle is in that relaxed phase as well. Okay, we could also do soft tissue release, otherwise known as our pin and stretch technique. This works really well. If we start the lock nearer the origin of the muscle, it's not going to feel as strong. As we move closer to the insertion point with the lock, it's going to feel stronger for the client. So it's quite nice. You could start in either of the directions, but it's quite nice to start with less intensity and gradually build up to higher intensity. Okay, we could do this multiple times by placing the lock as well on slightly different areas of the muscle tissue. I'm just going to focus into the middle of the tissue. So I'm placing the lock down when the muscle is in that shortened and relaxed position with the tool here. Okay, then I'm going to move the tool slightly away as the client extends the knee joint. Okay, then I'm going to hold that lock in place as the client does 3 to 6 repetitions. Excellent. And then I'm going to take the weight of the leg again, okay, as I replace that lock. Okay, nice firm lock, and then if you lower and then come back. There are slightly different ways of performing pin and stretch technique or soft tissue release technique. This is the way that I tend to do it. So we do 3 to 6 repetitions and then change the lock position. Okay. Okay, can you feel that? Good. And one more time. Okay, so this is quite close to the knee joint now, so it will feel quite intense for the client. And also you'll find that you'll have to hold the lock in place a little bit more firmly. Okay, excellent. And then from here, we can then flush that area out again with those nice long sweeps. Okay, then that's just allowing you to check the new tone in the tissue. And then if we've still found some areas of tension, we can then again go back in with those friction slides. Okay, then finally, we could also use the resisted technique. So the resisted technique, the muscle is in contraction, or is in an isometric contraction, as we're then doing long sweeps and friction sweeps over the tissue. Okay, so to contract it, I'm going to place my hand onto Lydia's lower limb here, onto the gastroc area. She's going to push up into my hand, so she's trying to flex the knee joint. And then from here, I'm starting off with those long sweeps so that she can see or assess how this technique feels. And then I can go into more targeted friction sweeps. Okay, so the muscle's in contraction the whole time. And then from here, I'm going to relax. Okay, and then again, flush that area to finish. Okay, so that was our IASTM to the hamstrings region.